press the button?
Yeah. Alright guys, welcome. Thanks for joining me. My name is Zach. As Drea mentioned, I am from the NICU and I actually work night shift. I've been a CHOC here now for about 6 years. I've always done night shift, but I've just been doing my clinical rotation with Drea. But it's been fun, it's exciting. So what I'm going to do today is I'm going to present to you guys on something that's actually pretty dear and heart to me, is safe sleep. As I mentioned before, we recently got the silver crib designation status, and that's, again, just kind of think of it like Magnet, but to be hospital-based for safe sleep champions. So it's something that we're actually really proud of. This was a project that we rolled out, I want to say about 2-ish years ago. Our safe sleep percentage was pretty low, and we took it upon ourselves to really improve that goal for us, and so we've been trying to get everybody to follow along with the safe sleep qualifiers, which babies actually qualify for it, and really implementing that practice. And the biggest takeaway for this is parents, like when you're in the room and you're doing safe sleep practice with the infant, the parents are watching what you're doing. And if they think like, oh, if they're doing this, it must be okay because the nurse did it, so it should be fine. That's kind of like a confirmation bias, because in their mind they're going to continue to practice that at home. And it's easy, right? Like if you're in the room and the baby's screaming and crying, and all of a sudden you're like, I got to go take care of another kid. Let me just prop the pacifier in with like a little froggy or the blanket, and that way they'll be consoled while I can go take care of my other kid. But at the same time, the parent's going to be like, oh, they did it, must be okay. They do it at home, and then that increases the risk of suffocation for the baby. And so this just is kind of like the mindset that we want to get everybody to be practicing in here, so that way it's the best practice for them to go in. So, first objective that I'm going to show you guys today, we're going to identify which infants are appropriately ready to begin practicing safe sleep. So, I'm going to start you guys off with actually a little quiz. Oh no, it's not. Never mind. Okay, so go ahead. Oh, I was going to a little PowerPoint here. Okay, so safe sleep fundamentals. Safe sleep versus not safe sleep. As you can see in the pictures up here, you have 2 different babies in 2 different positions. One is laying on its back and one is laying on its stomach. Just out of curiosity, which would you say is the more safe way to be sleeping? Right, always on the back. That's why they always use this like corny saying that back is best. And this was all driven actually from this campaign that was called Back to Sleep campaign. This was started like in the early 90s. And what they found out was that there was an increased risk of babies who were having suffocation, accidental death, or just an increased risk in SIDS, which is sudden infant death syndrome. And what they decided to do was they implemented new teaching strategies to promote babies sleeping on their back instead. And right here is where the study started. And this was the intersection point of the reduction in accidental deaths, SIDS, and suffocation. And what you noticed was that after this program got started, the rate of death, suffocation, and SIDS continued to decline, while the increased competence in practicing safe sleep went up. So it was just like a defining feature that, okay, if you actually implement this teaching strategy to parents and promote it, then you can have increased better results from the patients. So that's when we started doing this. So this happened in 1994, and they partnered with the American Academy of Pediatrics to initiate this campaign. And really, safe sleep is just standard practice of keeping babies on their back, moving all objects, loose clothing, toys away from the crib area. Because you might find, like, sometimes parents will like to add all these like little extra things because it looks cute, and who doesn't want all these like little cute plush toys in the crib and whatnot. But actually, if the baby is sleeping on their back and they might roll over, and they could like be pressed up against one of those objects, and that can cause them to actually have like a suffocation. So that's why we try to promote back is best. So one way I always like to do this is just to remember your ABCs. Baby should always sleep alone, no exceptions. What you'll find sometimes is parents will feel like, oh, I can only console my baby if I'm laying with them. which is very common. And so what they'll do is they'll lay with them in their own bed, but the problem is the parents, mom's sleep deprived, she's waking up every 2 hours to breastfeed or pump or console her baby. And what ends up happening is the parents themselves might fall asleep with the baby in the room or in the bed with them. And what can happen is, just as easily as a baby can turn over, a parent can turn over as well. And as horrifying as that is, there are a lot of babies who have died because the mom or the dad have rolled over onto the baby and the baby suffocated and died. And they don't know until they wake up however many hours later and find that their baby is unresponsive. So it's a very misfortunate thing that happens, but we always try to promote that babies should always be sleeping alone and preferably in their sleeping area, which primarily would be a crib. Again, always on their back. That's, like we said, back is best. And the C part of this little acronym is to keep the bed area clean and, again, free of objects, no loose clothing, no other toys, books, all that kind of good stuff. So the health policy. So the American Academy of Pediatrics actually released a whole statement on safe sleep practices, and this was again to aim to reduce the likelihood of SIDS, accidental suffocation, and strangulation by creating this safe sleep environment. And so we try to practice these both inpatient and outpatient, and that's why I was saying parents are always going to be looking to you as oh, well, the nurse did it, so it must be okay. But what ends up happening sometimes is parents come into their follow-up visit for their pediatrician, and they'll ask them what's the baby sleeping in, what's their environment look like, and they'll say, well, oh, I was previously in the hospital and I saw the nurses do this, and so that's what I do at home. And that's where even if you didn't work in the inpatient setting, if you worked in the outpatient setting, you could still be providing these teaching moments to them, because it's going to follow them forever. So it's always crucial that both the parents and the nurses are educated on all these practices and what actually qualifies for safe sleep. And so we actually have a little handout here that you can look up on Pause on CHOC's website. And it just shows you 3 different columns. Those who are not ready to practice safe sleep, those who can start practicing safe sleep, and who can absolutely be in safe sleep. And so, as you guys are med-surg nurses, you will easily probably end up floating to my unit. And so you'll have patients like this who may or may not qualify. And that's why it's good that we have this little teaching tool for you guys, because that way you can understand oh, if my patient falls in one of these categories, should I or should I not be practicing safe sleep? So the biggest ones right here to begin practicing, babies who are between 32 to 34 weeks gestation, so that's about 8 to 6 weeks premature, they can start practicing safe sleep. But what you'll find a lot of times is babies that are in the warmer's tilted up, the babies are on their side, they're wrapped up and surrounded by blankets for developmental positioning, which is true. We do practice positioning with them because we want to keep them nice and flexed and tight into the body. But nurses get very comfortable with keeping them that way, as again, they're trying to take care of their other patient, and if this patient's screaming and crying, they may not feel that they have enough time to adequately position the baby and then go run over to the other kid. And it just becomes a bad habit, really. And that's where the parents kind of take observation, oh, the nurse did it, so it must be okay. So we always try to promote that we only want to be practicing those who can, and those who fall into this category absolutely should be doing it at all time. Kids with a trach, they can absolutely be in safe sleep, especially because they'll be home that way. But because we always promote ventilator-associated pneumonia, or if they have increased secretions or reflux, we try to keep them elevated on the head of the bed, which is true, you can do that, but only for the first 30 minutes after the feeding. Babies who have neonatal abstinence syndrome, or those who are withdrawing from drug-abusing moms, same thing, they can be practicing safe sleep. You can still console them, but you still should put them back in safe sleep, or at least try to get them into that positioning as well. The things that are over here that are the absolute can't do it, babies who have umbilical central lines, babies who are on phototherapy, if they're intubated, if they are on respiratory support like CPAP, or they have a chest tube. Those are all things that require them to be in a different position, and that's okay that they're not in safe sleep. And that's because we have them on an apnea cardio monitor, so we can see if they have some kind of like bradycardic or desaturation. So this is available to you guys. You can always review this. And again, so just kind of like a stoplight. Red means anybody meeting this criteria should not be in safe sleep. Yellow, you can be practicing safe sleep. It's a great chance to start educating parents on how to begin this kind of practicing behavior. And then green, all babies in this category should be in safe sleep. And it's important to understand and stress to the parents that they should continue practicing this type of care even while at home. Questions about any of those things? Make sense? Go. Okay, so to have a little bit of fun, have you guys ever played Kahoot?
Yeah.
Okay. If you don't already have the app, or if you don't mind just real quick downloading it real quick, and we can just do a quick review game of all the fun things I just taught. Is everybody able to download it? Okay.
Sorry, mine's low.
There you go. I remember when I was in undergrad nursing school, we would do this after like every lecture, and we would be in like heated competition because some of our professors would make it a little bit more worth their while. They'd be like, oh, okay, the winner can get like candy, or they would like throw out a Starbucks gift card. One time, one professor was gonna give away like a movie ticket to like whoever wanted to see like the next like upcoming premiere. So people were very heated on this, and they're like, "That's ridiculous! I pressed the button, and it didn't go through, and I should have won." People would get like really angry when the stakes were pretty high. What was that?
Oh, you did? Okay. You want to try? Yeah. I'm trying on 2 devices too. It's like literally, it's loading already.
Oh, it's okay. I don't want to take up too much time, so we can just,
Okay.
you can partner up or something.
Okay.
Okay, you guys ready? Alright, so let's start. Awesome, good job. Yeah, so what you'll find with a lot of parents, and I see this all the time, they buy these products and it's like molded around, and it's like makes a nice little cocoon for the baby, and it's super cute, and I bet it's very comfortable because I probably would want to sleep in one of those things too. But what they don't realize is like how easily a baby could turn over, because babies move around, and that like cushioned ball easily be compressed up against the baby's mouth, and that's how they could accidentally suffocate. Same thing with the actual sleeping surface. If it's too soft, what can end up happening is the baby, if they were to roll over, it can compress down and actually like form like a concave shape, and again, they'll entrap their mouth and they'll be able to suffocate that way as well. So we don't ever want soft. Square, yeah, most cribs are square shaped, although they could be rounded, but it's more so the idea of like you want a nice firm surface, just so they don't have suffocation. Oh, brave.
7
Alright, let's see if anybody can beat her on this. Awesome. I would question if anybody got that wrong now. Although the picture's not there anymore, but if you remember from the picture, that baby had a bunch of crap in the crib. Toys, books, loose articles of clothing. And again, a lot of parents like to decorate the crib, and I'm sure they like to do it for the Instagram photos and to show all their friends, like, oh, Jay, look how cute my baby is, and all their little stuff. And that's cute and all if you want to do a picture, but don't leave the baby in there sleeping, because that would be no good. Alright, so let's see who's in the lead now. Ooh. Alright, Laura. Moving on up. Okay. Okay, so this was a sleep sack, and it absolutely is safe for them. It's actually probably the best thing for them. What you find a lot of times is babies don't always want to be swaddled, and they like to have their arms out. Although you can swaddle the arms in the sleep sack, or we call them halo sacks here. They like it, some do, some don't. It all depends on the baby. They have all different personalities, but it allows them to like also kick out their legs. Some babies like to be super flexed up like this, and other babies not so much. So it's just a kind of like a win-win. You get the best of both worlds. But otherwise, when you put a baby to sleep, we always at least swaddle them. They can be out if they want to, but we just try not to have the loose article of clothing. Like if a baby was sprawled out like this, you don't want to just throw a blanket over them, because that's where they can like twist and turn and then get it all jumbled up and again covering up the mouth. So the safe sleep sack, it allows them to be kind of concealed, but it doesn't have like too loose of clothing, if that makes sense. Okay, so who's in the lead now? Alright, Jessica. Okay. Yeah, so this one's a little bit tricky. According to the AAP, they actually do recommend for the first 6 months. Really, ideally, it should be about a year, but based on their research, at least at 6 months after, you could maintain the same sleeping surface. But again, we still try to recommend to parents, you don't want to be sleeping right next to your baby, because in the event that you were to fall asleep and roll over, you could accidentally roll over onto them. But definitely for the first 6 months, absolutely should be maintained a separate sleeping surface. All right, last one. Good job. Yeah, so 2 things there. 1, the baby is prone, and 2, the baby just has a loose blanket over them. Same thing. So babies who are prone like that can accidentally just kind of go like this and suffocate, or even if they did roll over on their own and they had the loose blanket, they could get tangled up in there and then suffocate that way as well. So that's why I always say back is best, keep the crib clean, and always maintain separate sleeping service. Alright, let's see who ended up being the winner. Nice, congratulations, Lauren. You get to be our Safe Sleep champion now. Go, Deb. I'm supposed to.
So do I get the movie ticket now or?
Alright, good job, guys.
You can go to my office, there's plenty.
Let's go steal some candy.
Okay, so do you guys have any questions about who qualifies for Safe Sleep? So this is good just to have as a review. You can, like I said, you can look this up at any time, especially since you guys will almost guaranteed you at least one of you guys will float to us in the NICU. So it's always good to have this as a review, and you can always review it with parents, because sometimes parents may just ask you, well, I saw so-and-so do it differently, you know, why are you telling me different? And it's always good to provide them this level of evidence so they understand from all angles. So next objective, explain modifiable risk factors associated with reducing the risk of SIDS and sleep-related death. So modifiable, meaning these are things that we ourselves can change. So again, we're always promoting a firm sleeping surface. We want to maintain a separate sleeping surface. The sleeping surface itself should always be free of objects, so no loose articles of clothing, no bedding, no toys, no books, things of all that nature. So these are all the things that, again, and I know I've reiterated this a lot, but it's so important to teach parents this. You always want to maintain the same level of practice with every patient you have. Because the moment that they see you doing something, they're going to think in their mind, that's okay because I saw the nurse do it. And you'll hear that time and time again. That's what they'll say to anybody. The nurse did it. Must be okay. But always try to maintain the same level of understanding from all patients. So describe safe sleep practices that are used both in the hospital setting and post-discharge. So I have a couple of videos that I want you guys to see. One of them is me. I showed this one first though. How many of you guys have ever swallowed me before? And for those of you who have experience, you'll know that timing and speed is really important. And that's cute that the baby was very nice and calm and she could easily do it, the speed at which she did it. But you'll find a lot of times they will be kicking and screaming and crying, and as soon as you do it, they're like already out of the swaddle again. So I always try to say practice with like doing it kind of on the faster side. I was ashamed that this video wasn't going to work. Maybe it'll look again. Because I do it on a different speed. But So, next thing I want to do is we're going to go on kind of these like little group exercises, and we're just going to answer it all together collectively as a group. And so I have 3 different patient scenarios, and we're going to refer back to like those safe sleep qualifiers that I went through. So you walk into your patient's room and you find that the patient is 35 weeks gestation on nasal cannula, and they're laying under radiant warmer. Patient appears to be sleeping, and you notice that the infant is swaddled in a hospital blanket, but also has a fuzzy blanket laying on top. The patient is also wearing a headband with a bow and a cloth doll next to the mouth that was worn by the mother to have her set so that the baby would recognize her. So what are the first problems or issues that you guys can think of that come to mind?
The fuzzy blanket is the one.
Yeah, number 1. Okay, so fuzzy blanket is a loose article of clothing, so automatically should not be in there. What else?
The doll.
The doll. Yep, same thing. Anything that's loose should not be in the bed, especially if it's by the baby's mouth. And this is common, you'll find in the NICU, because we give parents this cloth so that they can wear it and that it provides scent for the baby. And it's fine to keep it in there while you're watching them, but a lot of times the parents will kind of tuck it next to the mouth and be like, oh, my sweet baby girl, mommy loves you, I'm gonna go now. And you may not even be in the room, right? You could be with another patient doing something else. And you come back and then you find the baby's like with the doll. And it looks cute and everything, but again, bad practice, because maybe the parents are only with you for a couple days in the NICU or wherever, even on your unit, and maybe you don't ever even notice that they do this, but they're doing it while you're not even around, or they pick it up by the time you come back and you didn't know. These parents are going to go home and they're going to practice that same behavior, and you wouldn't even know, and you wouldn't even have had the opportunity to do education with them. So they would be like, oh, I didn't even know any better. So that's pretty common. The headband, same thing. It can easily come all the way down over the nose and mouth, and you'll see that a lot too, because even patients in the NICU will keep little hats on them initially to keep them warm, but sometimes you like walk in there and you'll find it like covering over their mouth. So again, always want to make sure that there's nothing loose like that in there. So the teaching points that can be made, same thing, just always make sure you tell the parents there shouldn't be anything loose in the bed, no loose articles of clothing, nothing on the head, nothing that can pose a risk of suffocation for them. And then what are the next steps as the bedside nurse? Really the next steps would be just to have like that sit down education with them, and usually what I just ask is, have you ever heard of safe sleep? Do you know what safe sleep is? And sometimes they'll say, yeah, kind of. And then I usually just try to ask them, what does safe sleep mean to you? And that's where they can tell you what they think they've heard or what they think they know. And that's a good idea and time to then address those pain points with them. And like, okay, so where did you hear like your information from? And this is where you can kind of give your education to them, and that way they can take that home with them so they don't have any mishaps at home. And then how and what would you document? For us, we have a particular area of education that we do in Cerner. I'm not sure how it works on the med-surg unit, but this is where you can actually educate on safe sleep. There's actually like a category for it, and that's how we document it. I know med-surg. Okay, so we'll go to the next one. Okay, next scenario. You have a 32-week gestation infant who's admitted to the NICU due to prematurity and hyperbilirubinemia, so jaundice. An order is placed to have an infant under phototherapy with the lights to reduce the bili level. You come into your shift and you finish getting a report on the patient where the parent asks, I noticed my child is laying on their stomach. We were taught that they need to be sleeping on their back. This doesn't seem right. Are they okay like that? So, is this patient supposed to be in safe sleep or not? No, right. Phototherapy is a contraindication to safe sleep because we're trying to expose as much of the skin as possible so that more light penetrates it to reduce the bilirubin level. So in this instance, the baby should not be in safe sleep. So this is a common position that we do for them, even though, yes, it is contraindicated that putting them in a prone position normally at home, but that's because they're not on an apnea monitor, they're not being monitored centrally by us in the hospital, at home that way. So this way, we do allow them to put it like this, because this way, They're getting exposure not just from the blanket of their stomach, but also the overhead light as well on their back. And obviously they're wearing their little goggles, and as we know, like anything on the head does pose a suffocation risk. And so the same thing, like you'll leave your baby like that sometimes, and you'll come back into the room, and then the goggles are like all the way down here. And you're like, oh my gosh, what happened? And you're like trying to fix it. So no, they do not need to be in safe sleep. So as the bedside nurse, what would you guys say to your nurse if you had a concern about that? Or if the parent had a concern about that, how would you address it to them?
Just like explain that, oh, for their condition, we actually want to expose as much skin as possible, and you normally wouldn't do that at home. It's good that you like notice that, and you know they're connected to monitors, and we're monitoring them, so we know that they're okay.
Exactly. It's really as simple as that. And I would probably say 99% of the time the parents would pick, oh, okay, I understand. And you give them that teaching point, and from then on they may not really ask any questions. But those are the biggest things that you really address with them. And if they really were to give you any kind of pushback, you know, you always can refer back to the qualifying list, you know, the stoplight with the red, the yellow, the green, and say, this is what we use at CHOC, this is how we decide like who gets to be practicing safe sleep. And then if you needed to escalate it further, you can always get your charge nurse involved, or even the doctor, and they can explain as well. But always good to make sure you have that conversation. Good job. All right, and the last one. So you have a full-term infant who's getting ready to be discharged home in the next couple of days. While working the past 2 shifts with the same patient, you've caught the mom sleeping with the baby on a pull-out couch. After educating her on not allowing to co-bed, meaning sleeping in the same area, she places the infant back in the crib. However, you notice that the crib is filled with toys, books, and a music playing machine. The mom appears stressed and overwhelmed, and the baby starts crying. She says, the only way she sleeps is either with me or in the crib with her favorite items. So what is the risk when parents co-bed with their child? The baby themselves can roll over, or the parent themselves can roll over onto the baby. So, always try to maintain separate sleeping surfaces. And if you guys remember, for at least the first, how many months? 6 months. Good job. How would you address the objects in the crib to the parent? Any takers?
Tell her that they look cuter outside of the crib.
Definitely one way of presenting it to them. Yeah, just really explain to the mom. I understand that you feel as though that she probably sleeps better with being surrounded by her favorite objects, but we always want to make sure that we maintain a safe sleep environment and educate them again on not having any of those objects in the crib while the baby is sleeping. And then, are there any concerns to address prior to discharge? If so, what are they?
Ask the mom why she was stressed.
Yeah, that's a big thing. Mom feels overwhelmed and stressed while in the hospital. She probably is going to feel that way and then some even more while at home. And she's going to want to revert to the same practices that she was just doing. And that's why it's really important as you as the bedside nurse to really implement that education to them and really help them understand that although this may give them a temporary relief because maybe the baby would be easily consoled and stop crying, in the long run it poses too high of a risk because the end result could be accidental death of the baby. And so that's why it's always good to reiterate there are other consoling methods that don't require all these other objects in the crib. Obviously, co-bedding is very common. We just ask that if they feel as though they want to console their baby, to hold them in an upright position and not actually lay down with them, because too commonly and too easily, the parent might end up falling asleep. But holding up in the chair, no problem. Do you guys have any questions about these different scenarios that we went over? No? Okay. And then our last one, identify define the hindrance in maintaining a safe sleep environment. You guys gonna watch another video?
Hello, my name is Maddie, and I'm a Safe Sleep Ambassador here at Torrance Memorial. We want to highlight a very important and sensitive topic for our most precious patients, safe sleep for your baby. At Torrance Memorial, we deliver more than expert care. Our maternal child staff, physicians, and specialists have dedicated themselves to ending sleep-related infant deaths in our community. In 2020, we were recognized by the National Safe Sleep Hospital Certification Program for our commitment to best practices and education on infant safe sleep, making Torrance Memorial the first hospital in LA County to be officially recognized as a Cribs for Kids National Bronze Certified Safe Sleep Hospital. Now in this video, we will provide steps to create a safe sleep environment for your baby and lower the risk of sudden infant death syndrome, also known as SIDS, and other accidental sleep-related deaths. Every year in the U.S., thousands of babies tragically die suddenly and unexpectedly. SIDS is the leading cause of death among babies between 1 month and 1 year of age, mostly occurring when the baby is between 1 to 4 months of age. Other sleep-related causes of infant death, which are usually accidental, are suffocation, entrapment, and strangulation. We care for our patients like our own family, so we want to ensure that new patients are equipped with the knowledge on how to ensure safe sleep and protect those we love most. So let's walk through some of the best practices for infant safe sleep. There are preventative measures for pregnant women that can help reduce the risk of SIDS, including regular prenatal care checkups and avoiding smoking, drinking alcohol, using marijuana, and illegal drugs. Additionally, after your baby is born, do not allow smoking around your baby or in your baby's sleep environment. Room sharing reduces the risk for SIDS, but sharing a bed with your baby increases the risk for sleep-related deaths. We feel it's ideal for you to share your room with your baby for at least the first 6 months to a year. If you bring your baby into bed with you for feeding or comforting, make sure to return the baby to their own sleep area designed for infants on their back on a firm surface. When you and your baby go home, make sure to give your baby plenty of observed tummy time when they're awake to strengthen your baby's muscles. Now, many moms and moms-to-be may not know that babies who are breastfed are at lower risk for SIDS compared to babies who were never fed breast milk. According to research, the longer you exclusively breastfeed your baby, meaning not supplementing with formula or solid food, the lower his or her risk of SIDS. Babies need to be placed on their back to sleep for every sleep, including naps and at night. Starting out on their back is the most important for reducing SIDS risk. If the baby rolls over themselves, there's no need to reposition the baby. Babies need to be placed on a firm surface without blankets, pillows, and toys to ensure the safest sleep environment. Avoid letting your baby get too hot during sleep. Dress your baby in sleep clothing, such as a wearable blanket, designed to keep the baby warm without the need of loose blankets. Remember, if you are warm, the baby's warm. Look for signs of overheating, such as sweating, and by touching their chest to see if they feel hot. Never cover the baby's face, and keep their head uncovered during sleep. When you deliver your bundle of joy at Torrance Memorial, we will send you home with a safe sleep swaddle as well as training on how to properly swaddle.
Alright, so you guys have any questions about that video? Yes.
Just like when she said if the baby like rolls over, like by themselves, don't reposition them. Is that because they're old enough to where they can?
Yeah,
roll over
if the
and
baby themselves can roll over, it's okay because they can easily go back and forth, but they're not going to develop that motor function just quite yet. That's why a lot of times you'll see like how parents are doing tummy time. That's perfectly acceptable if the baby's already awake, but if you put them prone like that, they may not roll back over, and that's where you have the risk of the suffocation. A lot of good stuff in the video, and it's just really a lot of things that we've already reiterated during this lecture. Is about like removing the loose clothing, the hats, the blankets, and instead of using a blanket, you could use one of those Halo sacks or the Safe Sleep sacks that we have here, even at the hospital. So these are all tools that you can use, and a lot of different education points to give your parents. All right, so we'll do one last assignment. Okay, so this is your baby, and this is your crib area. So the baby is currently on its side with a blanket roll, keeping it on its side. She's got her two favorite books, which is very well advanced, which she's already reading Catcher in the Rye. Very good for her, way better than I was. She's got her iPad to watch her favorite shows. She's got her favorite plush toy, and she wants to be a doctor later in life, so she also has a scalpel. But that also might have been left over by the provider, so I'm not really sure what was happening there. So, questions. In this picture, what are the immediate problems that you see?
Everything.
Everything. Okay, what's everything?
There's a blanket roll that the baby should probably be in safe sleep.
Right. So the baby has a blanket roll and it has just a blanket thrown over it. So always want the baby on the back because currently the baby's on its side. You don't ever want a problem like that. Same thing with the loose clothing that should, or the loose blanket that should automatically be removed. Okay, so that's good. What else? The headband. Good job. So the headband, although it looks cute and it makes you know that it's a girl, easily can slide down right over the mouth. Risk of suffocation. Okay, good job. What else? Scalpel. Yes, it's great that she wants to be a future clinician, but it probably should not be playing with a sharp knife. So you'll find time and time again, and even myself, I'm guilty of doing it. Sometimes I accidentally leave things even in the crib area. And although they may seem like insignificant because they're super tiny, they still are remaining a choking hazard, and two, you just don't ever want anything loose like that lying around the crib. Things that you might commonly find are like the thermometer probe covers. That's common. Babies who have IVs, the little scrub caps or alcohol pads, you'll find those like kind of lying around in the crib or in the water area. Okay, good job. The plush toy, again, cute, fuzzy, shouldn't be in the crib. At least not when babies sleep. The iPad, definitely no bueno. They actually recommend that babies don't even watch a screen until about 2 years of age. But it's very common practice for a lot of parents to throw on some kind of music or show on a screen, and the babies will become like, when they get a little bit older, because right now they only see like little blots and shapes, but they'll be like, ooh, light, what's that? I want to watch the show. So, and especially being that close to the baby, definitely no go. And it's in the crib itself, so no loose. And then the books too. Parents love to line the outline perimeter of the crib with all their favorite stuff, so always want to make sure that there's nothing in the crib. So this baby should be on its back, should not be held up by a blanket roll, should not have the loose blanket, and all the objects, including the headband, should be removed from the crib. Good job, guys. And that is everything. Do you guys have any questions about anything that we reviewed today? No? So you guys are all Safe Sleep champions, and if I see you guys in the NICU, I'm gonna come to your room and I'm gonna be like, see if this baby's in safe sleep. And you're gonna be like, it is, because I removed all the clothing, all the objects, educated the parents, documented, and now you guys can just be like NICU nurses. Awesome, thanks guys.
Yeah.